Good afternoon, everyone. A very warm welcome to all the delegates, faculty members, and all other brilliant students who are attending this session. As we dive into the next session of Medmemorate 25, we are going to shift our focus to something very deeply affecting each and every one of us. That is our NEET PG preparation and the strategies for the NEET PG and INI-CET exams. We are facing it. Exam stress is real. The pressure to perform, the constant competition and feeling of not doing enough can be overwhelming. But here is the good news. You are not going to be alone. More importantly, you are not going to go through it alone. Today's session titled the mental health preparation as well as the NEET PG preparation strategy for the medical students is designed to you not just to talk about the exam stress but to equip yourself with the strategies to effectively manage it. And to guide us through this journey, today we have a very special, passionate doctor, a calm and clarity in medical education, and moreover, most importantly, someone who truly understands the strategies of NEET PG, INI-CET, and all the entrance exam because he walked the same path. He has millions of students, around 2 to 3 lakh students to go in that path and to succeed in it. Please join me to welcome Dr. Vinayak Senthil, sir, uh, one of the most prominent in the medical education field and director of Speed Medical Coaching Institute, one of the oldest medical coaching institute for which is guiding the students for the past 20 to 25 years. I welcome you, sir. And today, we is not going to just act as a faculty here, but going to be your own friend who is going to guide you how to revise, how to keep your mindset, refine your focus, and reinforce your resilience. So, I request Dr. Vinayak Senthil, sir, to take over the session.
Uh, at the very outset, let me thank God Almighty for giving me this day and the opportunity. And I thank Dr. Raghu for inviting me to speak on this orientation for NEET PG, INI-CET PG, or FMG, or for a super specialty courses of NEET SS or INI SS, DM, and M.Ch exams. I'm really privileged and honored to be a speaker in a very wonderful platform for students is Medusane. And Medusane as a team under the guidance of Dr. Raghu, they're doing an excellent and wonderful job for giving a very good, not only about the orientation and about the facts and about the guidance, they also give the important content for the students to learn at a free of cost. And they also help the faculties for an opportunity to take a class. So they're doing an amazing job for both the students and also for the faculties at both the ends. And so I thank the entire team for giving me the opportunity and also thank all the students who are present here, who have taken your valuable time to attend the various sessions and also my session today right now. So even before I could start, I was a very, very humble student, aspiring for medicine and MBBS. My dream is to become a doctor. And that reality that I could feel that I want to become a doctor just started when I was in standard 11. I'm a student in government ORTV school in Sivakasi, where I started my career there. That way that I want to do medicine came into my mind when a group of friends were discussing that what they each and everyone wants to do. And when my turn came, then I am supposed to say I'm a doctor. I want to become a doctor. Then when I said, when my friends, all of them laughed at me. They said because they didn't laugh at me because it's not that I cannot do it. It is that the discussion in the 11th standard, I was given a group of commerce group. Even without knowing, being in a commerce group, you can't go to medicine. You have to be in a science group. Even that basic knowledge was not there. I was from a small village near Savakasi. It's called Sangamana. Now, what happened was, then I realized, then people said, Vinayak, you are in a commerce group. You are not even a science group to do what you want. Then I went to my principal and I asked, sir, can I get a science group? My principal said, all along from standard third to 10th, you are very difficult to clear your exams. This is not for you. And this is for people who could do exams well, study well. And you are a below average student, we cannot give it to you. And I was just standing outside my principal's room for more than 1 month, and he got irritated every time when he saw me and said, "You don't disturb me. If you don't like me, you just go out of the school." Even in fact, he called my parents one day, said, "You please take him out um, from the school because he is not a good student. He is not a good student to give good results to a school." And my parents also felt bad, and I mean, I had an aspiration to become a doctor. I don't know how to do it, but the point struck me: if I don't do right now, then I can't go there. Then seeing my attempt of not going to the class and being outside my principal's room for asking for a science group, then he finally turned to me and said, "I'll give you an opportunity that 1 month I'll make you in the science group. If you could pass all the subjects for that month, I'll give you the science group." That was the challenge he gave to me. And that's the day that I wanted first to study for myself. That's the day I decided that I have to pass all the subjects. Then that point of time I started studying, and my aim was to clear all my uh, subjects in that monthly exam to get the science group. Then I went all out. I can do whatever I can. Then I did this exam in the first monthly test, and after the first monthly test, the results came, and there was a teachers meeting with the correspondent and the headmaster and the principal. Then they called me, and I thought probably I'm not done well. They're going to send me out of the school because I'm pestering them and asking them. Hello.
Yes, sir, you're audible, sir.
Am I audible?
Yes, sir, you're audible.
Is everything good to go?
Yes, sir, everything is going good, sir.
Yeah. So, and they're pestering, and I mean, they felt me as a nuisance. They're going to send me home. That's what I believed. But what I realized was the principal told me, Vinayak Senthil has got rank number 1. He didn't pass the exam. He cleared all the subjects with 99 to 100% results. Then my principal and the correspondent asked me, "What do you want to do?" I told them one thing. I have a ambition and a dream to become a cardiothoracic surgeon. I didn't know where I got it from. It was even before I entered MBBS. I'm trying to tell you this. This is the reason why I'm telling this story. Most of you could resonate with that. I don't know how many of you could resonate with that, but this is what I was looking at. And I want to become a cardiothoracic surgeon even before I joined my MBBS. Probably I got inspired from some cardiothoracic surgeon or some doctor before that. I don't know how I got inspired, but I got into medicine, want to become a cardiothoracic surgeon. Then I wrote my entrance exam, and that time the theory plus entrance was there. Then I got into the entrance, and I got Government Kilpauk Medical College. I studied MBBS in Government Kilpauk Medical College. Now that was also not very easy because I went through the first time my own preparation, but I couldn't qualify. Then I had to take a coaching in Chennai. Then I could score better and get into medicine. So the whole struggle came to Chennai and finished medicine. Then after I finished medicine, then I want to accomplish my dream of a cardiothoracic surgeon. But when I was doing my MBBS program, I was very, very sincere to my college. I was very, very sincere to my classes. And I used to write books because I know I don't come from a very affluent background. I come from a very, very, middle or mid or low average income group of my financial status. And so that I felt my parents were finding it difficult to pay the bills, to pay the yearly fees to the college. Then what I used to do is whenever I finish my first year of my MBBS, after that I write all the notes which I prepared. Then I give to as a notes to the juniors and to sell and make my money. And that money I used to pay my fees. This is how I survived for all the 4.5 5 years of my MBBS program. And finally, when after my MBBS, I want to do my post graduation, and financial status in my family didn't allow me to go ahead and do the way I wanted. So I had to work. When I was working after MBBS, I was doing 3 duties. A morning duty, afternoon duty, and night duty, and one clinic early in the morning after I finished my night duty. All these 3 duties put to the clinic fetched me not more than 15,000 rupees per month. That 15,000 was very important for our survival, for my family to survive. So deep financial stress. And then it became a few years for me to simultaneously prepare and get on to my post-graduation, my interest was surgery, cardiothoracic surgery. I entered my general surgery program in Kilpauk Medical College. And when I entered the Kilpauk Medical College, I always used to work for my survival. I mean, morning I used to go to college, apart from the duty days, I used to go for my night duties in some hospital, earn some money, give it to my family and for myself. This is how I finished my general surgery program in post-graduation. And I was very, very sincere to that program as well. And I did with utmost passion and sincerity. Then what I did, then I went on with my, I wanted to do cardiothoracic surgery after my PG, but I couldn't do that. What happened was, then again, I have to work. Then I started working. And after working, it became 8 years for me to get the financial stability to do something up than that. So after 8 years, I wrote an entrance exam. And when I write an entrance exam, then I qualified the entrance exam and took M.Ch cardiothoracic surgery in Madras Medical College. And I'll tell you, I joined my MBBS in 1995 in Kilpauk Medical College, and I finished my M.Ch cardiothoracic surgery in Madras Medical College in 2016. So try to understand, 1995 ended MBBS, finished M.Ch cardiothoracic surgery in 2016. How many years is that? It is almost more than 21 years, 21, 22 years to accomplish my dream from MBBS to cardiothoracic surgery. But all that I have done through government systems. I've gone through MBBS and post-graduation general surgery from Government Kilpauk Medical College and M.Ch cardiothoracic surgery from MC, all through studying, writing exams, getting a seat, and joining all these places. And all didn't happen overnight. It took 22 years and 23 years hard to accomplish my dream of what I wanted. So I knew what it's all about. Every MBBS student today is aspiring for a super specialty. At least to minimum of a postgraduate degree, not less than that. I mean, nobody is here to settle only with MBBS. That is not the aim of an MBBS student. An aim of MBBS student is to become a specialist or a super specialist. And when you want to accomplish the dream, it is not that easy. There could be a lot of issues each and every student can have. This is my issue. Someone can have something else. So then I realized that if I had that problem, someone else can have something else. But why cannot I support someone, to accomplish their dream of a specialty of their choice? That's the very reason I started the course called Speed Medical Institute to train MBBS doctors to achieve the post-graduation and super specialty program. Because I underwent that, I knew what it's all about. Then I wanted to help my juniors and people who are aspiring for the same. So to date, having started this institute, this is a 25-year-old institute. I've trained more than 3.5 lakh doctors to aspire postgraduate seats of their choice, and train more than 35,000 super specialty aspirants to achieve dream M.Ch or DM seats of their choice. And the reference I could always tell you is, though if you are a medical student, if you are listening to this video, if you want to know who is Dr. Vinayak Senthil, the best reference is not just going through the Google and search Dr. K. Vinayak Senthil. Of course, you get 10 to 15 pages in my work that I have done for 25 years. But the most important is you go to your professor and assistant professors in your college and you ask them, who is Dr. K. Vinayak Senthil? That's what gives me more kind of a satisfaction for the work that I have, because more than 90% of them, of your professors, assistant professors, or associate or junior professors have been trained in Speed Medical Institute. What it means, see, when we do something which we're very passionate and want to give to people who want it in the same way, and that gives a great and huge amount of success, because I know the technique, I know how to make it a MBBS student, what level he is from a government college or private college, irrespective of what he has done, how to train him, how to tell him what are you supposed to do, what we need to learn, how you need to learn, and how we need to apply then to get your right results. Then go on to the post-graduation, then go on from post-graduation. Then after post-graduation, you need to know what specialty you're interested in. After you know decided what specialty you're interested in, then you need to train in that specialty to achieve what you intend to achieve. So that's how it works. It doesn't work in any other way. It's the same way what I'm telling you, it works. And it has worked for lakhs and lakhs of students. And it will also work for you in case you aspire to want to become one that way. So you hope you understand what I'm trying to tell you. So what it drives, so you need to understand that if you want to become a super specialist or a specialty doctor, what it drives is the passion that drives. For me, even before MBBS, what was driving me was my dream to become a cardiothoracic surgeon. That's what I was trying to tell you. If you remember that, what was driving me was my passion, my dream. So only that can drive, nothing else can drive. So you need to enjoy the process. What I'm trying to tell you is all this are medical specialist upgradation programs and the courses. For all that you need to do is you need to enjoy in doing in every step, because you are becoming a super specialist. You understand what I say? And I hope, I mean, most of you could resonate with what I'm trying to tell you.
Yes, sir.
Yes?
Yes, sir. Sir,
See,
there
I
are
mean, I have n number of examples and stories to quote and tell you that people have achieved what they intend to achieve. I mean, this choice of what they want to do, I mean, is very, very important because it's a brand that they're going to carry with them. So if you are going to carry a brand, I mean, could your brand could be a physician, your brand could be a general surgeon, or brand could be an orthopedician or a pediatrician or a gynecologist or a psychiatrist or a dermatologist, whatever it might be, or it could be a cardiologist or a neurologist or a cardiothoracic surgeon or a surgical oncologist or a nephrologist or endocrinologist. So whatever might be your interest in the choice, or a cardiothoracic surgeon or a plastic surgeon, whatever might be the interest that is in you, it is achievable and it is doable. Yes, all that you need to be is you need to think of that and be in that, and you need to find a right mentor. And right mentor who has undergone that, and right mentor who could guide you correctly and appropriately, so that he can help you to save a lot of time, and he'll help you to achieve what are the steps that has helped him to achieve, and what are the steps he has helped someone to achieve it. So that's what the right space that will give you a right guidance. Now, I want to go to you one simple example here. I had a medical student and who was also not affordable to pay a course fee. So, of course, our course fees was very, very affordable. Even that affordable course fees he was not able to pay. And he asked me, sir, if you can give me a job in your coaching center, I mean, I can work and also learn. I said, okay, fine. He looks like one like me. Why can't? Then I said, okay. And that time, what I used to do is there'll be a computer and a projector. I used to press from the computer the next button so the next slide can go on. I told him, you can do the job what I am doing. So I can take care of the students who are coming to the classes. So what he used to do is from the second year of your MBBS, for continuous 4 years, he used to come to the class on Sundays and he used to press the button of the next. When the teacher says next, the next slide will go on. So he has learned the entire 19 subjects from anatomy, physiology, biochemistry to pathology, microbiology, pharmacology, ENT, SPM, community medicine, surgery, medicine, OG, skin anesthesia, radiology, all the 19 subjects for 4 times. This is called passive learning. And this because he didn't just want to learn, because that was his job. He said that was my job, and as I do my job I learn. So he knows on the entire subject for 4 times. You'll not believe that he passed every semester of MBBS with distinction and gold medal. And when he passed his final year, he got as many gold medals as possible from Madras Medical College. And you not believe, even before he finished his MBBS, he got into a very good topmost rank in, I mean, All India ranking in PG entrance. And then he got rank of 15, and he got into a profession of post graduation. He liked orthopedics, and he joined orthopedics in Madurai Medical College. That seat he got even before he finished his MBBS internship. Then he joined, and after he joined, he came back and said, I want to be a faculty in speed. And then he said, okay, fine. From the first year of his orthopedics, I gave him classes for orthopedics to him. Then he joined as an orthopedic faculty and I was paying him. Try to understand that. Yes. And he became a faculty, he started training because what he learned, he wanted to give back. Then he trained more number of students in his specialty of orthopedics, and he enabled more people to get what he achieved. That's how it works. And he is none other than Dr. Mohammed Yunus from MMC, Madras Medical College. So this is the story which I want to tell you that. So people have come from various backgrounds, different backgrounds, and what all was driving all of them was the passion to do it. So in my experience of this 25 years of training, 3.5 lakh and more number of students in PG segment and more than 35,000 students in super specialty segment, what I could understand was each and every doctor has a passion to do something. All that they need to do is they need to identify what they want and what they like. Once that is decided, and rest of all, we have you have a beautiful mentor like me, mentor like Raghu, and mentor like Speed Medical Institute that runs a program called Dopamine for PG program is there for you to help you, and we assist you. There are three important parameters that works for a success for preparation for entrance exam. Number one parameter, you need to have the right mindset. That's very, very important. I'm going to tell you this. I'm going to finish another 5-10 minutes. You need to have a right mindset. That means the mindset, you need to believe in yourself that you can achieve, irrespective of the background where you're from, irrespective of the background of MBBS that you done MBBS from government medical college or a private medical college or done from foreign medical university, irrespective of it, you should believe that is doable and you can achieve it. And you need to have a strong positive mindset that it is possible. You are uncomparable. You are a deserving student. It is not that I failed in my MBBS subjects. Can I do it? I'm from a private medical college. Can I do it? I'm from a foreign medical graduate. Can I do it? Everybody who has completed MBBS is doable, irrespective of the place where you study from. Understand that first. Number one. Number two. Today, the right mindset has to be sustained, persistent. Hard work has to be there. The mindset has to be doable. I can do it. And it is possible for me. Yes, it is possible for me. Yes, and that mindset, the positive mindset, is very important. And you need to believe in yourself that yes, I can, and you should respect yourself. Yes, because I have a huge respect for myself that I can do it. The second is the right content. See, they can ask anything from 19 subjects, but in 19 subjects, there's a template. For every subject, there's a template. You need to know the template first. On the template, what are they asking? See, every exam has 200 questions. In the 200 questions, there will be a same area be asked. You need to know the right template. What are they trying to ask? Suppose in case surgery, if you ask me, they'll always ask you a question on thyroid, especially on papillary carcinoma or anaplastic carcinoma. They'll always ask you on a breast management. They'll always ask you on a salivary gland swelling, most probably a pleomorphic or adenomyocystic carcinoma. And in endocrine, they'll ask you on a pheochromocytoma. They ask you on a carcinoid tumor. And they'll ask you on esophagus about malignancy in esophagus or malignancy in stomach and hepatocellular carcinoma or Child-Pugh score or a splenic tumor. Or they'll ask you on an IBD question on IBD. They'll ask you a question on rectal cancer. They can ask you a question on renal calculus. They can ask you on prostate BPH or prostatic cancer. They can ask you on testicular tumor. They can ask you on penile cancer. So these are the areas which are commonly asked in entrance. And vascular TAO, they'll ask you on varicose vein. They'll ask you a question. In general, they can ask you a question on burns. They can ask you a question on shock. They can ask you a question on infection and types of wounds. So these are the template which is there for every exam. This you should know first. So first you should know what is the right template. I mean, what are in the template? What are the areas are must to be asked? There is a template every exam it gives. Every examination board gives for the faculty to prepare the question for entrance exam. These are the areas you need to prepare and give us. So that template you should know. So that means you should learn the right content. It's not everything important. You're not doing a PhD here to do a surgery or PhD to do medicine. Nothing. You are preparing for an entrance that you need a correct and appropriate information and the concept and the knowledge to apply onto an entrance exam and to get your results. So you need to learn the right content. For that, you need to learn the right content, you need to know the right template and the right content from the right people and the right mentor. I mean, is the mentor could inspire you, influence you, and to teach you in the right way that you could remember easily and happily. It's not the taking notes. It is not that someone tells you write and learn from that. No, you learn from the teacher's experience and the faculty experience, what they have learned and how they have understood, what they're trying to put it across. That on the examination day, it is not that you write it. The faculty who taught you will come and tell you in your ears to answer that question. That's how it has training has to be. That's why we are in place here. I mean, that's why we are experienced, we're experts in that. Yes, we are the experts. And you need to look into the people like us and to learn from us so that you can bring down your time. You can achieve that in a short span. What I achieved in 23 years of time, you can achieve with less than 1 year of time. Why you need to spend that techniques you can learn within a year. And then you can move on quickly. So what I achieved in 23 years, you can achieve within 12 years. So MBBS, 6 years, 5.5 years, and post-graduation 3 years is 8.5 years. If you want to do super specialty, add on another 3 years. That is 11.5 years. That is 50% of time what I have achieved. Because I have undergone a tough process, not mean everybody has to undergo. I mean, I can teach you how you can avoid certain things and how you can implement certain things and how you can move on. So that's one part. So I was talking about the right mindset. Number two, I was talking about the right content. Third important ingredient about the entrance exam, clearing entrance exam, passing an entrance exam is the right technique. See, you need to know what the knowledge you acquired from a MBBS or coaching or learning an app. That information you need to apply on a given question. On that day of the exam, how well prepared that you can consolidate all the knowledge that you have and to put it across for a question that is asked. You need to know a right technique. And right technique for a given, see, people will be good in knowledge, people will be good in knowing things, but they may not be good in giving an answer for an MCQ. So giving an answer, a right answer, an appropriate answer for an MCQ is an art that you need to learn, because you need to know how the MCQs are made, what they are up to, what they are looking into. It's a word game that you need to understand. They'll be very specific and precise, that you need to know exactly what they want and what they ask, and how on what they want you answer accordingly. You understand what I say? Yes, everybody understand? Yes. So the right technique is very important. So we'll teach you the right technique. Yes, to apply the techniques. So for the answers that you know, you can go straight away and give an answer. That answer, it is simple. You can know the most common type of skin cancer, basal cell carcinoma. The largest organ in the body, skin. The largest gland in the body, liver. Yes, those are simple questions and straightforward questions. The most common type of malignant melanoma, superficial spreading. The most common type of basal cell carcinoma, nodulocystic or ulcerative. These are simple, basic questions. Everybody can answer. You can also answer. So straightforward. And if you have boiled down to two options, yes, between A or B or B or C or C or D, which one to choose? How to choose? What to choose? What is the priority? Two close answers for given a question. What are the techniques to learn? We'll teach you that. Third, if you don't know a topic, only four options are there. And how to bring out an option for the questions are difficult. I don't know. There are techniques to do that. And the MCQ practice and sessions that we have that will help you to enhance, to answer at a subconscious level. And when you look at a question, the answer pops on you. They say, this is the answer. How do you get it? You get into the right technique. So, I cannot do it minutes. I can do it a little longer time. And so it needs a little more time to teach you what are the techniques are there, how they architect, how they frame a question. And based on the framework, how you understand the framework answer, whether you know the subject or you don't know the subject. I have helped thousands of students and lakhs of students. For almost 50% of the paper, they answer with the knowledge. Rest of the 50% of the paper, they may not know. They know of 25% of it. With that 25%, how to enhance the number of questions that can be correct after the exam. So that's the right technique. So three things we have been discussing about here. The right mindset to achieve the positive mindset. Number two, the right content. What is the right content you need to know on the 19 subjects to achieve it? Number three is about the right technique. So these three are the most important ingredients. And on top of it, you need to have the right mentor. You need to talk to someone. There should be someone to tell you, come on, I'm there for you. They should correct you. They should tell you, this is what you need to do, this do, don't. So this is very important. You need the right mentor. And you need to choose the right mentor. If you feel that I am a right mentor, you can choose me and I can help you. So right mentor is important and the right faculty is important. And that mentor should give all that you want. 100% he should give you and you should feel that you have to achieve. Now, as I'm talking to you, you feel that there's a passion in to teach you. There's a passion to upgrade you. So there's the same kind of a passion a mentor should have for you, to help you, to assist you, to support you, to handhold you to achieve your dream, what you wanted. That's very important. You understand what I say? So if you are looking, if you want to be a specialist, if you want to go for a good postgraduate seat, if you're going for a super specialty seat, and it is doable, because below average student with a financially difficult position, I have done it. Anybody can do it and you can do it. And all that you need to do is, first and foremost step to understand is, first you write your name and you think what is good for you, and you work in few of the departments that you're interested in, see is it good for you and suits your personality. Then you'll find one in you. It could be a surgeon in you, could be an orthopedician in you, could be a physician in you, could be a pediatrician in you, could be a cardiologist in you, could be a neurologist in you, could be an endocrinologist in you, could be a cardiothoracic surgeon in you, a surgical gastroenterologist in you, or a psychiatrist in you. Who are, you say you feel that is in me, and you are that, and you write that specialty behind your name and the degree that you wanted. In a period of time, you'll achieve it. Yes. So it's a wonderful platform for me to share my experiences and my knowledge that I had in this domain. Hope it was useful to you, and any questions I'm willing to take. Thank you very much.
Thank you, sir. Just a few questions, sir, which I think most of them have messaged me to ask you. So, first one is, sir,
Yeah.
how do we plan subject-wise preparation? Like, there is something called daily targets. There is someone telling long-term goals, someone telling you start with this subject, that subject. This is like every YouTube video gives a different perspective that the students gets confused at the end, following everyone's idea. So, what is your take on it, sir?
So your question is very precise. What to start first? Am I right?
Yes, sir. What
See,
to start first and how to start first?
yeah, I'm going to tell you that.
Yeah.
See, of the 19 subjects, you need to write all the 19 subjects. And what you need to do is, and make one separate box. 19 subjects you write, anat, physio, biochem, path, microform, FM, ENT, opthal, surgery, medicine, OG on one side, and skin anesthesia, radiology, psychiatry on four. All five compartments you make it. Then what you do is, make one master box. Make one master box. First, you need to do is, you need to tick the subjects that you're comfortable and you like it. First, you need to tick it. First, you need to tick. Suppose you like anat, path, medicine, surgery, something like that. You tick those first. And what you do is, you make a red color cross for subjects you don't like and subjects you're weak. You get what I'm saying? So, of the 19 subjects, first you need to mark the subjects that you like and you love the most. And when you see the subjects you like and the subject you love the most, is that what you wanted to do actually? Probably you, if Raghu likes psychiatry, you first try we're going to take psychiatry. That means he loves psychiatry too. Similar, people who like subject eventually they become one that way. So I'm just telling you that. And subject you don't like, you just tick it, you cross it. And what you do is you enter the master box only with the crosses. That means the subject you don't like. For the subjects that you don't like, start first. Subject you like, anyway you like, you'll do better. And that brings only less time to study and remember and recollect and give it an exam. So subjects that you're not comfortable, subject, suppose you don't like biochemistry, you don't like pharmacology, you don't like community medicine, suppose I'm saying you don't like FM, you don't like pediatrics, you don't like anesthesia, you don't like any of the subjects, you mark those subjects, that's the order of priority. The most you don't like, number one, and that comes in that order. The most you don't like to the less most you don't like. So that order you finish first. You first after 19, you say what is the score of don't like. The don't like score, the don't like score could be 6 out of 19, 7 out of 19, 8 out of 19. That to the extent the student how many he doesn't like. That you finish first because that needs more time because you don't like it. And the things that you like, you keep it to the last. That's how you need to approach. And things that you don't like, you need to really hunt for a good mentor. He could really inspire you to make that subject easy for you to learn. You got it? Raghu, you got it?
Yes, sir. It was really a perfect plan, I guess, because each one have different ideas and each one have different strengths and weakness. But unfortunately, everyone runs behind the YouTube videos where they tell start with pediatrics, start with surgery, start with medicine, and at the end, they get weakened on the subject they don't believe themselves to be strong at. And they repeatedly study that few subjects with the faculty tells, and at the end, they are getting confused by the exams. Are. Sir, and last and finally,
Really, Raghu, I'll just finish this. I'll finish this. The tendency of the students is to start with the subject they like, actually.
yeah,
That is the tendency of the student because they're comfortable with that. See, when you're comfortable with something, what do you do first? You do it last. In entrance, unless you don't address the weakness, it's very difficult to improve the score.
true. As a
Yes.
as a preparing student last year, I 100% accept you, sir, because I keep on studying the subject which I like, and at the end,
Yeah.
those subjects anyway I will get score, but those subject which I don't like, that is the one that gets affected at the end. Sir, what message would you give to the students at the end of the session who didn't succeed last year, who is not succeeding in the past few exams, and now giving their attempt?
Very important. The people who have been studying for 1 year, 2 year, and 3 years, and they are very desperate. See, this time I have to make it because I cannot wait for one more year to do this because already I have lost my time, I lost my money. I'm really low. I'm little kind of I don't have, but my stress is huge. See, what I'm trying to tell you is the students who are studying for 1 year, 2 year, 3 years. Just listen to me for a few minutes. See, your experience is more than a student who's finishing MBBS today. Your kind of exposure to the exam because you have given more than one or two or three exams, what the exam means. Now what you all that you need to do is at this point of time The most important to increase your score, improve your score, what you wanted is, as we discussed in the previous question, you need to fill up the first weaker areas. That means you will give one grand test in the whatever the system you are in right now. Give one grand test. As we finish the grand test, you mark all the questions you made wrong. Bookmark all the questions you have made a mistake. Those questions, identify those topics, what you have made a mistake, and read those topics. And last 5 years of NEET PG paper, look on all the mistakes that you have done and those topics you concentrate, that will improve your score. What you need to do is first you give a GT of 200 questions. Once you give a GT, after that, if you have got 150, then see the 50 questions where you gone wrong and just read it and again give the same GT next day. Even the same GT, when you give next day, you don't get 200 out of 200. Again, you will get probably 160 or 170 because the willingness to correct is very difficult for us psychologically, for anybody. So what you do is, until the last 5 GTs, last 5 years, repeat, I'm telling you, last 5 years questions, that you give us a GT, that until you get 200 out of 200, you just keep practicing to address your weaker areas and the weaker topics where you believe. Now, what you do is, whatever the weaker areas of the 5 last year papers, write down in a separate paper or a notebook, and you write those topics subject wise and read it. And once you read it, you can see how much of score is going to improve. And one more important thing I'm telling you, for the students who are repeating for 1 or 2, 3 years or more, you kindly give maximum number of questions in the exam, because the studies and my experiences over 23 years have told me the people who attended more number of questions, maximum number of questions, more than 95%, they have scored very good rank. You get what I say? And believe in yourself. Don't get dejected. Don't feel low. You always feel you can do it and you will do it. Yes.
Okay, sir. I think this one thing when you have told, I just remember my days when I came to Speed Institute for my final revision course. So that time, sir gave me this one particular piece of advice, and I can vouch you all that my GT score in the May, I think, yeah, May was just 110, 105. This was the number of questions I could get right out of 200 questions. But believe me, guys, this one particular advice I followed for just 1 month, and my GT score before my exam, before I went to exam, was 140 to 150 right question, and in my exam it was 158 right questions out of 200. So you can see the jump of number of right answers from the May to June, just 1 month with this just piece of ideas. I think you just have again 1 more month for you guys to write your NEET PG, and this one piece of advice is going to jump your marks from nowhere to somewhere where you can get a good college.
And I want to tell one more thing to Raghu also. See, what I want to tell you is the student who are finished their MBBS, not prepared anything, half prepared, no preparation is done properly. I mean, you know, you're going to prepare for 1 more year. For yourself, you have told, this is not enough. I'm going to prepare for 1 year. I'm just going to give a trial exam. For all those students who are giving a freshers or going to give a trial exam, what if you answer 200 out of 200? And what if you answer 150 out of 200? What difference it makes? Anyway, you are mentally prepared to give a trial exam because you don't feel it's a real exam, because you don't feel that you're going to score anything and get out of it, because that's what is your mindset. If that is your mindset, yes, give 200 out of 200 and see what's happening. Even luck can work. I'll tell you why. Because there is one student of mine, he listened to this advice. He was not prepared at all, totally not prepared. And he got some app, but he didn't prepare through that. He went and answered 200 out of 200 and he got a rank of 1800. Understand this, 1800. No preparation, only this technique. Advice I'm telling you, this is a technique. He came to me and said, sir, I don't know how I got 1800. He said, how I got 1800, I myself don't know. Sir, I just believe only one advice of yours. I answered all questions. The luck worked in a way for what I marked without knowing. For some question, I didn't even read actually. I just only gave the options. I didn't even read. And that worked in my favor. See, you need to allow the luck also to favor you. You need to give space for the luck, boss. Dear students, you need to allow the space for the luck to work for you. See, you need to make 200 paper, not 150 paper. If the exam is giving 200 questions, you are only making it 150 or 150, 120. No. If that worked for the and he got psychiatry. He got psychiatry. He wanted, he said, he thought, sir, I am going to prepare for 1 year, 2 years, going to spend 1.5 to 2 lakhs of money and time. Then I thought this is the process. No, you have changed the process and even one advice. So there are plenty of advices like this. See, we have developed a product called dopamine. This is called Joy of Learning Medicine. It's specially made for the medical students who want to enjoy medicine, who want to experience joy of medicine, learn in joyful way, and to prepare for exams also. And we have developed a beautiful product, and you can contact us. And and then we have a Facebook and a Insta page. You can follow it. It's called Dopamine. The app is also called Dopamine. It's going to come up. It's going to enhance the way you're going to learn, the way you're going to enjoy medicine, and as you enjoy, and you need to be successful in doing what you wanted. So that's how we are in, and we're going to give you an amazing experience and learning experience of medicine through dopamine. Okay, thank you.
Yes, sir. So at this outset, I think I also wanted to add one more thing to all my dear friends and all my dear juniors who have joined here. So you may be a final year MBBS students who have graduated just and entering internship, or you have completed your internship and going to just give the first attempt of NEET PG. Nevertheless, we are going to launch one of the fantastic revision program called Dopamine Search. Details of it will be shared at the end of the session and as well as in the validatory ceremony, where we are going to have all the 19 subjects going to be covered at the 4 days of time. And in this 4 days, it's going to be a rapid revision of whatever you have learned from the first year to final year MBBS. So if you are going to be a final year MBBS students who have given your exam and entering internship, or if you're going to be a person who have completed your internship and going to enter into some coaching institute, nevertheless of what coaching institute you go, just refresh whatever you learned in the last 4 years of your MBBS and the last 1 year of your internship, and just make sure that even though you're going to give the first attempt, as sir told, who knows, luck may favor you. Just go, just revise with us all the 19 subjects, and I'm very happy that sir gave me the opportunity to interact with you all and to learn with you the psychiatry, a beautiful subject where I will be covering it. So I request all of you, those who are seeing this video, if you are a final year MBBS, just graduated and going to enter the internship, or if you are the person who have completed your internship, this course is yours. It is not going to be a big conceptual, but it is going to cover the tactics and strategies that you need to know, must to know while entering into a NEET PG exam. So I think sir has given you a brief idea about what a NEET PG exam is and how to prepare for it. Whatever question you have, whatever question, just share it in the WhatsApp group of our participant list, and I'll definitely make sure that sir prepares. Sir is a person who prepares a n number of reels for the students, covering all your questions, all your tactics, just 1 minute. Similarly, all your questions will be covered as a 1 minute video by sir in the upcoming days. So you can continue to post all your doubts in the WhatsApp group so that sir will be covering you. Thank you once again, sir, for joining with us today in your busy schedule. And today, we are going to have our valedictory ceremony. And again, sir is going to be our chief guest for valedictory ceremony. And I'm very happy to invite him on behalf of everyone for the valedictory ceremony at 6 o'clock. And now at 3:15, we are going to start with our quiz. Again, the quiz master is none other than sir's wonderful student, one of the student of sir, Dr. Karthikeyan sir, who is studying DM cardio from the renowned medical college in Delhi. So he is going to stand as a quiz master, and he's going to give you some of the beautiful questions and insights in cardiology through the session. So I request you all to join at 3:15 sharply for the quiz finals. Thank you so much, sir, and thank you once again for everyone, those who have joined here.
Thank you very much. Thank you, Raghu and Medicine. Thank you very much.